Hey, my name's Will, and I'm super stoked to be at this stage of the candidacy process. This year, I'll be graduating with my doctorate in chiropractic, as well as award my diplomat as a certified chiropractic extremities practitioner. I also have taken all the rock tape seminars involving functional movement technique screening, kinesiotaping, instrument-assisted soft tissue management, cupping, as well as muscle flossing. And my background from college is kinesiology with an emphasis on sports medicine and athletic training. A little bit about me and why barefoot. I practice a very proactive, sustainable form of healthcare, and in that, I preach about not having reliance on medications, drugs, braces, crutches, etc., etc. And the barefoot paradigm kind of falls within that kind of theme. The reason why I got into barefoot, while I was sitting in a lower extremities biomechanics class, learning about all the intricacies of the foot and different articulation points, pathologies that are involved. And during the course, we got fitted for orthotics, and I had a couple questions about the longevity and sustainability that orthotics has, as well as patient outcome. And in the reality of the minute you remove the orthotic, what exactly happens to the foot? Like the amount of times that the foot has to adapt without orthotics in different shoes, and and the efficacy of how much the patient's actually going to use it. That was my question. And if I'm going to be practicing a sustainable form of healthcare, how sustainable are orthotics, and why not just try to retrain the foot? So I did a little guinea pig project on myself, got my first pair of Vivos, really upped my barefoot training. 3 months after my first pair, I got rid of all my other shoes, and now I really just rotate between 5 different pairs of Vivos, and I love it. And I use that mentality with my patients. The first thing I do with a lot of my patients to kind of teach global mobility on a micro scale is I have them do a toe touch test to test the restriction in the posterior chain. Have them test that, then roll out the feet, and then retest. And typically you get a pretty drastic increase of motion just from a little bit of myofascial work on the foot itself. And that teaches just how connected everything is and how much the foot can have an effect globally on the whole body. That's a little trick I use from rock tape. And I already use your information as well as other accounts such as the Prehab guys via Instagram and MoveU for my patients as take home, and it's resonated very well in a lot of my patients, and it's easy for them to apply it. As for why I'd be a good candidate, this is just going to be another tool in my toolbox, and the more tools and resources I have at my disposal, the better I can help my current patients, and the more I can offer my future ones.